Here's a CT of the abdomen and pelvis that was performed in a patient who was having left lower quadrant pain. And we can see here in the colon here, there are some areas of diverticula that are coming off. But when we come more distally to the sigmoid colon, we can see that the sigmoid colon here is thickened compared to the rest of it. And the thickening looks like it's a fairly short segment. It goes all the way from here all the way up to about here. And so this length here looks thickened. If we scroll down a little bit more, we can see some of these diverticula come off of the colon, but there's this fistulous tract that we can see extending from the sigmoid colon right here. If we come down, we can see this fistulous tract. There's some gas within it, extending all the way here. Here's some fluid and gas within the tract, extending all the way to the bladder dome, causing it to look thickened compared to the rest of the bladder. And we can also see that there's some gas within the bladder itself. Now, when you see gas within the bladder, we think that that can sometimes be associated with a urinary tract infection. It can be most commonly from recent instrumentation. So if a person's had a Foley catheter within there, gas is very commonly seen within the bladder. But what you want to do is make sure there's no colovesical fistula, and so you look around the bladder to make sure there's no fistula. But in this particular case, we can see this fistulous tract that is developed. This can happen with multiple bouts of diverticulitis or really severe diverticulitis. I'm just going to put this on the coronal view just to be able to show that connection here. And in this patient had multiple bouts of diverticulitis that eventually the inflammation created a fistulous tract between the bladder and the colon itself. So this is a case of colovesical fistula.